The Sugar Babes, round and round. Kruti Khemani is here. She's from Continuum, Physio and Rehab. More conversation.
This is Good Morning Mumbai with Hrishi K.
So what does Continuum do now? I believe you trained here in Nanavati with Dr. Irani, who used to work with the Indian cricket team back in the day.
He used to, yeah.
And subsequently you went to Australia and you did your masters there. So and now you're back here and you have a sprawling space. So tell all.
So I think people think I'm a little mad in the head because I come back to India after 10 years, after, setting up life there, having the kids there, everything. And they're like, who comes back from Australia? And I say only one thing. I said, there's enough good quality physios there. I would be just another fish in the pond. And we are an absolutely thriving country right now. Look at the way sports is going. We need more of us to come back here on ground, and we need ourselves to be updated and upgraded to the standards of the rest of the world. And I think I'm still not an expert. There's lots more for me to learn, but whatever I gathered and learned in 10 years, I really wanted to come here and contribute. And I think I'm so happy I've done that, because it's only been just close to 2 years now that I opened, Continuum with my husband, and he's the equal partner in this, and he's the backbone, I would say. And I am so glad, because he lived there 15 years and I dragged him back, and I'm sure that he's now not repenting it, I'm hoping. But I think the way Continuum works is that, one, I made it up. The space is about 1,500 square foot, but it's made up in a way that if a patient is coming in pain, the first thing they want to see is a nice space, a smiling receptionist, smiling physios, a very positive environment with good vibes. Because when you're in pain, or when you're suffering from an ailment, you just want that positivity at the first get-go. And I think we've seen enough clinics where we've gone and we've seen grumpy faces of very busy practitioners who don't even make eye contact. That doesn't help, and all our appointments are an hour long. So, which is why I said we spend half an hour just talking to you. We just want to dig into everything about you. We want to know everything about your life, about your ailment, and then comes the treatment part. The treatment's easy. It's the diagnosis that we focus on. And I think the diagnosis is much more accurate if I know you as a person, and then your injury secondary. And I think the injury, again, I've realized in India is people don't realize that physios or physiotherapists can actually diagnose an issue from the core. They think that we are a second-hand practitioner who are always referred by a doctor, which is still the case. Don't get me wrong. We are still dependent on doctors to send us their patients so that they don't have to look after them. A busy cardiologist doesn't want to teach the patient breathing exercises and, the walking regime. A busy orthopedic surgeon doesn't have to teach exercises to the patient saying, well, you're weak in these muscles, that's what you need to go strengthen. Leave that job to us. So I think they do still refer to us, but I think also if you are in pain or if you have an ailment, if you just look up across the globe what physios can do, you might just save time in having to go through a cycle of seeing one and a second and a third practitioner and then landing up with a physio. So I think I think in 2 years we've managed to gain that confidence in people at Continuum that they can walk up into the center and be able to get an answer to their question, whether it's aches or pains, whether it's some sort of a symptom that they're not able to figure out what it is. Because what we actually do, we dig into the history and we also make the appropriate referral. I've actually walked people out of the door after 15-20 minutes of talking with what their ailments are, and I've said, you know what, you actually don't need me. You need a counselor or a psychologist. Or, you know what, you don't need me. You're a surgical candidate. Off you go to an orthopedic surgeon. Or, no, I think this is a heart issue or a gut issue. Can I please make a referral to a surgeon or to a gastroenterologist, because this does not look orthopedic or musculoskeletal to me. So I think we as professionals are a lot more mature now. We are very happy to hand over, the person or the suffering person to the right healthcare professional. I think that's just pure ethics, and we're very big on that. We really, I think all of us, we're a team of 6 now, and I can see that same culture in individually each one of us, that we're very patient-centric, and we really like to make sure that you're in the right hands and in good hands. So we make that phone call right in front of the patient saying, sir, I think you really need to see this person because they don't need me, they need you.
So how does one get in touch with Continuum Physio and Rehab? Would you give out your number or?
Yeah, but very happy to. There's clinic numbers that you can call on, which is 82913611 and
Just very slowly again, please.
Again, 82913611 and 3612. These are the clinic numbers, and you can obviously reach us on Facebook and Instagram on Continuum Physio.
That's NEW.
Correct. So CONTINUUM Physio, all small, no gaps. And it's just literally the minute you walk in, I mean, you probably sometimes even feel like, yeah, I know I'm at the right space. If I was a patient, that's exactly how I would feel. Yeah.
Yeah. Listen, thanks for rolling by. This has been an absolute pleasure, and we hope to have you back when we have one of our theme shows again.
Thank you so much.
Cheers.
Thanks for having me.
We're going to do some messages and come back. Don't go anywhere.